If you've been involved in any type of accident where you have a knee injury, there are certain things that are really important for you to find out. When people have injuries to their knees, oftentimes they go to an urgent care or a hospital, and the hospital or urgent care will provide an x-ray, tell the person that their knee is not broken, no fractures, that they should take some Tylenol and put some ice on it and send them home. The thing that you need to understand, and this goes for many body parts, is that x-rays are a diagnostic tool that is just used to determine whether there are fractures to bones. Now there's other things it can pick up on, but generally speaking, for orthopedic injuries like a knee, it's looking to see if there's been a bone fracture or a shift in the kneecap. Now there are other things that an x-ray can pick up on, but generally speaking, in orthopedic injuries, it's used to determine whether there's a fracture in that bone, in this case a knee, or a shift of the bone. Many injuries that involve knees have nothing to do with the fracture of the bone. We are oftentimes dealing with soft tissue pathology. So, for example, if you had a meniscus injury in your knee as a result of a fall, the x-ray wouldn't see that. If you tore your ACL or PCL, or you had any other type of soft tissue injury to the knee, the x-ray won't see that. The most important thing after you have a knee injury, first of all, is to get to the hospital or an urgent care center. Make sure there's no catastrophic fracture. Make sure there's no subluxation of the knee. Then give us a call. The second thing from a medical standpoint that you need to do is get into an orthopedic doctor or into physical therapy. But the physical therapist will provide you with exercises that will hopefully help make whatever condition you have better. But to the extent that there's a tear, the orthopedic doctor will do orthopedic testing. And those doctors that do the orthopedic testing can oftentimes tell whether or not you have a tear of the ACL, PCL, meniscus based on those orthopedic tests. And then, and critical to your case and critical to your health, is obtaining an MRI. Because the MRI will show if there is soft tissue pathology. It gives you a diagnostic capability that x-rays do not give. And knowing whether you have a soft tissue injury is critical, because those types of injuries, particularly if they are of a certain nature, need to be addressed immediately. If it is unaddressed, there are times that it can go on to provide more problems later on as a result of arthritic changes that could occur if it's not remedied. So if you have a knee injury, call us, call an orthopedic doctor, and to the extent that you need it, make sure you're getting an MRI.